As I was waiting to come up, I was thinking about the big ideas that have been discussed at these meetings over the last decades that were sometimes kind of jarring, but ended up proving useful. Like the concept that our complex work of healthcare might actually have a simple goal, reducing suffering. Like the idea that transparency might be inherently good, as nerve-wracking as it can be. Like the idea that zero harm, as difficult as it might seem to achieve, was the only defensible target and a useful target. Now, in that spirit today, I hope in that tradition, I'm going to talk about what I consider the unifying theme that cuts across all the types of work that we do. Whether we work on patient experience or member experience or safety or employee experience, we all work to create social capital. Now, this is great work. It's important work. And my goal today is that you leave this room seeing your roles in just that way. Social capital is the way people interact with each other and with their infrastructure, enabling organizations to do things they otherwise couldn't do. What does social capital look like? When teams huddle to discuss near-miss safety events, that's social capital. When doctors and nurses round together, that's social capital. When caregivers at the Mayo Clinic adopt a social norm that you don't stare at your phone as you walk down halls when there are patients around, that's social capital. My guess is that every one of you has examples from your organizations where you are building social capital, and this meeting is all about sharing them. I really do think that today, at this moment in history, social capital is every bit as important, actually more important than financial capital. Now, I do appreciate the importance of money, but you can get money from the outside. No one can create trust and respect and teamwork for your organizations but you. And when I look at the stronger healthcare organizations as I go around the country, I see organizations with more social capital. I see organizations with fantastic teamwork, with high reliability culture, with pride in values that actually mean something to people. These are the organizations whose performance got better during the pandemic. Now, I hope that the takeaway from this talk is that we have to approach social capital with the same intensity and discipline that our CFOs apply to financial capital. And my hope is that every one of you will see yourself as the CFO for social capital for your part of the organization. So let's talk about what that job means. So here's why building social capital is so important. Bowling Alone, The Collapse and Revival of American Community, is a really important book that came out in the year 2000 by Robert Putnam, one of the key early thinkers about social capital. The title alludes to the fact that more Americans are bowling than ever before, but bowling leagues have collapsed. People are actually bowling alone. And they're also skipping out on PTAs and all sorts of other group activities that not so long ago gave meaning to the term social fabric in American life. We have analogous issues in healthcare that make building social capital an imperative. As a side effect of the incredible scientific progress we have enjoyed, the work of healthcare has become incredibly busy, but lonely. Not to whine, but many days when I walk the halls of Brigham Women's Hospital, where I work clinically, no one says hello. Everyone is staring at their phones, trying to catch up with their inbox. There is so much that needs to get done, and so many people involved in the care of every patient. But teamwork is spotty, The fact is, chaos is common, and friction is the norm for patients and caregivers, and it's scary for everyone. Patients are unnerved, and clinicians are constantly apologizing because we don't quite have our act together. Now, back in the days when Kurt and I worked together, we used to go down to radiology and look at x-rays together, but not anymore. Today, we spend hours staring at computer screens, the healthcare equivalent of bowling alone. I never realized that good things were happening when we were standing around, waiting as a team for the elevator down to radiology, pressing the down button over and over, even though it was already lit up. Those good things were social interactions, and they made care more fun, and they made it better too. Well, something has to change, and it isn't going to be caregivers staring harder at their computer screens. Now, as we manage the change, we have to keep in mind what must stay the same. In my book that came out last year, I offered a list of the top 10 things I love about healthcare. I'm not going to repeat them all. But the first was that patients really do appreciate our work. Not all of them, but the vast majority. And we can see that in the millions of positive comments that patients share with us every year. A second theme was that you can be on a great team. At this stage in my life, I'm not going to be on any great athletic teams. But I really do have a realistic shot at the healthcare equivalent every week when I walk into my primary care practice at the Brigham, say good morning to my half-dozen colleagues in Area A, and put on my white coat. And a third thing is something that's both great and terrifying. You start from scratch with every single patient. Who you really are is on the line in every single interaction. It's how a musician feels every time before stepping on stage. I'm going to come back to this starting from scratch challenge at the very end of my talk. Now, I became just a little bit more optimistic that we can preserve those great things last spring when I visited Pierre Pham, the Chief Experience Officer at New York City Health and Hospital Corporation's Elmhurst Hospital. He's here today, and Sven and I and Pierre will be doing a panel at 4:30. Now, I met him last year at this meeting for the first time up at the hub, and he invited me to come visit. And so later that spring, I did. Now, many of you will remember that Elmhurst is the Queen's Hospital where COVID hit in full force in March 2020, and we saw just how horrible this pandemic was going to be. You'll remember the news clips that showing how Elmhurst had to park a refrigerated truck outside the hospital to hold the bodies of the dead. Now, Pierre took me to the emergency department where, even in the calmer times of last spring, patients were double parked on stretchers outside of the bays. They had been triple parked during the COVID surge. And as we walked through the ED, I said something to Pierre about how leaders everywhere were talking about, quote, getting back to basics. Pierre said he'd been hearing that too. And then he said to me, my version of back to basics is treating humans like humans. He gave me his example. He described how patients might lie on those stretchers in front of us in the ED for 12 hours or more, but in one small, high reliability act of kindness, Elmhurst found the funds and the compassion to make sure every patient has a pillow under their heads. Yes, it's true that pillows in the ED have a way of disappearing. And yes, having a pillow may not seem like the most important quality measure in healthcare. But imagine the difference it makes when someone comes along and slips one behind your head as you lie in a stretcher in an emergency department full of uncertainty about how things are going to turn out. The clarity of Pierre's thinking and his values have stayed with me. I mean, treating humans like humans is something I can remember. So how do we do that and be the way we want to be with high reliability? I got a glimpse of the tools we need when my daughter gave me this book about 10 years ago, Brokerage Enclosure: An Introduction to Social Capital. Now, I probably used that phrase in the past, but I didn't really know what the term meant, to be honest, so I needed an introduction. We all know about financial capital, the money that enables organizations to do things they otherwise couldn't do. We know about human capital, the people that enable our organizations to do things they otherwise couldn't do. Social capital is the way those people interact with each other and with their infrastructure, enabling organizations to do things they otherwise couldn't do. When we look around healthcare, we see lots of problems for which social capital is a much better answer than more mouse clicks. At the front lines of care, we all know the value of teamwork, and boy, do we feel it when we don't have it. High reliability culture is social capital. So is reliable use of your IT platforms. There are currencies to social capital, like trust, engagement, respect. We often take them for granted, but we shouldn't. The strongest organizations have more social capital than the weak ones. And I think that is the reason that they tend to have stronger financial balance sheets as well. It is possible to build social capital, and it is possible to hemorrhage it. We want to build it, of course, and as the title of this book states, there are two ways to do that. The first is brokerage, in which you increase variation within organizations by nurturing new ideas and bringing ideas from other places. This meeting in Orlando every year and our interactions in the months in between is all about brokerage of ideas to create social capital. The second means is closure, where you reduce variation and you converge on best practices. You adopt operating systems, like measuring together, like managers rounding on at least 2 direct reports every day, just the way clinicians round on patients. You standardize around actions that build high reliability, that hardwire values like trust, patient-centeredness, and respect into the system. So let me take a few minutes for what might seem like a business school seminar to emphasize just how important your work to build social capital is to your organizations. To do that, I want to talk about the connection of 3 key concepts: social capital, strategy, and competition. I promise that we'll be getting back to the front lines of care soon. But I want to start by sharing a comment to me by my colleague, Michael Porter, who said social capital lies at the core of strategy. Now, Michael is the Harvard Business School professor who I think most people would agree shaped modern concepts of business strategy. And I started working and writing with him about 18 years ago when I was in senior management at Mass General Brigham. Now, like many big thinkers in various fields, Michael has a genius for making complex things simple. He's confident that he knows what's important and what isn't, and that enables him to boil things down to their essence. I've watched him say things like in classes at Harvard Business School with senior managers who come for educational programs. I've heard him say, how you are organized really does matter. And then I've watched those senior executives feverishly write that down in their notebooks. Now, I was one of them because the first time I really interacted with him, I found myself sitting across a little table, and I'd asked him, what would you do if you were us? And he said, measure what matters to patients. And I was writing down in my notebook, measure what matters. And then I stopped because I was embarrassed. I was thinking he had to be wondering, what are they paying this guy for that he has to write that down? But as it turns out, that measuring what matters to patients actually is an important idea. And how you are organized really does matter. And social capital really does lie at the core of strategy. But to appreciate why he said that, you have to grasp what he means by strategy and the distinction between strategy and operational effectiveness. Now, operational effectiveness is working hard to get better at what you do. Strategy, on the other hand, is making choices about what you're going to do and what you're not going to do in order to create value for your customer. And in healthcare, that means making things better for patients. Now, as we all know, making things better for patients is hard. It's really hard work. But Michael understood that even if you are creating value, there is a risk that you won't be rewarded because of the threat of competition. And one of his big contributions intellectually was helping organizations think clearly about the threat from competition. So Porter's 5 forces are something that every MBA knows all about. It's a framework that he came up with in 1979. It's the different forms of competition that can threaten the ability of an organization to get rewarded for the value it creates. In the center, there's what you traditionally think of as competition. There's your rivalry with existing competitors who are similar to you. So if you're a hospital and there are a lot of hospitals nearby, purchasers can bargain down your prices until perhaps you have no margin. But there are other types of competitive threats. There is the power of the purchasers and the power of your suppliers. For example, if there's only one insurance company or only one supplier of something you must have, your ability to negotiate with them weakens. And then there's the threat of new players entering your business, or at the top, the ability of your customers to meet their needs in other ways. I think this 5 forces framework helps explain why healthcare is so difficult these days, why there are so many times you hear people saying, I've never seen it so difficult. It's more than COVID. The world has changed with all sorts of new players and new apps, and there's been consolidation everywhere. There's a growth of consumerism where people know they have choices and they're going to make them. The 5 forces have qualitatively intensified, and life will never be the same. So what the heck are we supposed to do? Now, one of Michael's famous sayings is, strategy is the antidote to competition. We wrote about this a few years ago in an article called Why Strategy Matters Now. We said you can't respond to the threats from competition by merging with everyone in sight. Even if you could, that would only mitigate one of the 5 forces. There would still be 4 more. The response has to be strategy. You can't just outrun or outwork the 5 forces. And you can't just cut. You have to make choices. And those choices should be guided by clear thinking about 2 simple questions that lie at the core strategy. The first is, what are you doing for whom? In other words, what's the value that you are creating for the patient? And the second question is, how are you going to be different? Because if you're doing the same thing for everyone the same way as everyone else, then ultimately markets do work, and you are going to be competing based on price. And then you can't get the margins that you need to thrive. So these are the two key questions to keep in mind. What are you doing? What are you doing for whom? And how will you be different? So Michael and I gave our answers to those 2 questions for healthcare in an article that we were writing in the spring of 2013, right before I met Pat for the first time at that breakfast he mentioned. As you can see from the text on the cover page, we said that providers must lead the way. And we said that value for patients must be the overarching goal. Now, it's important to note that some people think value just means spending less. Our take is something different. If you had kept on reading in the article, we wrote that better outcomes, including patient experience, have to be the top priority. In other words, less suffering. And then we wrote that the pursuit of efficiency in the pursuit of those outcomes was the second critical priority. And we made the argument that sustainable competitive differentiation, that how are you going to be different, that comes from the creation of social capital. Now, this is the figure from that article that summarized our framework. I tweaked the language inside those circles a little today, and in fact, I'll do that right now. In short, this framework pushes social capital as the way to create sustainable competitive advantage. The first item, organizing into integrated practice units, that basically means creating great teamwork. The second means measuring what matters to patients, not just what's relevant to fee-for-service payments. The third means adopting incentives for improvement, and that includes transparency as an incentive, not just financial incentives. The fourth means improving care across patients' entire journeys, not just when they're having a transaction. Number 5 means emphasize the need for high reliability across systems. And number 6 at the bottom means the data infrastructure that supports high reliability, high value care. I hope something like the HX platform that we're talking about so much at this meeting. Now, the arrows between the circles make the point that these components are intertwined. Now, I made this figure myself on PowerPoint, and I remember struggling a long time to get those arrows to look good. And I can see that a couple of them are not quite on target. They're a little off on the bottom. And I feel a little bad about that because I didn't know it was going to happen this way. But this article has ended up being viewed more than 730,000 times as of December, according to Harvard Business Review. Probably more than everything else I've written combined. But the point of those arrows are not that these circles are like menu items in a restaurant where you pick what you want. They're synergistic. Like if you have data but no teams, or teams without data, not much is going to happen. But if you have teams and data and incentives, then get ready for action. Now, I'm not arguing for these things because at Ganey. The point that I wanted to make by telling you the chronology is the truth is that I came to Ganey because I showed Pat Ryan this less than perfect figure once we started talking about me joining. And he assured me that this vision was completely consistent with where he wanted the company to go. And so here we are, almost 11 years later, at a meeting that, from my perspective, is all about building social capital. So to summarize the business school seminar part of my talk, we have more intense pressures than ever before from competition. We need strategy to make our choices as we deal with those pressures. And we need social capital in order to execute on our strategies. So what do we know about building social capital? One of the clearest findings from our data is that it begins with pride. Now, one example I love, this is the poster from a campaign launched a decade ago. Atlanta can't live without Grady. We got a bunch of people from Grady here, and you can ask them whether it's true. At the time of this campaign, that it started, still goes on, there was a very real possibility that Atlanta was going to find out what it meant to live without Grady, because this safety net hospital was on the verge of financial collapse. It had all sorts of quality and safety problems, and workforce turnover was measured in single-digit number of months, not years. This campaign was created to remind the public about how important Grady was to Atlanta. There were billboards, signs on buses, web-page advertisement. It's a beautiful campaign. Athletes and celebrities, often with the Grady Red Cross over their hearts, saying Atlanta can't live without Grady. And black and white photos of patients saying, I wouldn't be here without Grady, like this one. Now, I know some of you are thinking, this was just a marketing campaign. But the fact is, marketing campaigns can help define and strengthen your culture. They can't be the only thing, but they can be an important thing. And that was the case with Atlanta Can't Live Without Grady. As intended, this campaign helped with the outside world. Politicians got the message, and came through with some much needed financial support. But talk to anyone who worked at Grady during this time, as I have, and they will tell you that the campaign had a huge impact on the people who worked there too. It made people proud. Turnover decreased. Quality and safety improved. It made them more resilient and ready to work together to improve care. Now, a whole lot of other things were going on and went into that turnaround too. And I'm not saying that everything is all fine today, but things did turn around. And the pride that flowed from this campaign was part of it. Now, our data show this is no surprise. The data give a two-word answer to the question in the title, what drives loyalty in the workforce? That answer is social capital. These data show the risk factors for healthcare employees being ready to look around and move on from our engagement data. It's based on 410,000 people nationally. Now, if you look at the items on the top part of what's shown here, you'll see why I say pride really matters. Look at the top items. I like the work I do. My work is meaningful. The work I do makes a real difference. If the responses are unfavorable on these items, there's a 6 to 8-fold risk factor for people being ready to look around. You go down a little lower, you find this organization treats employees with respect. I respect the ability of the person to whom I report. And you see teamwork items. And as you go over these data, you see over and over social capital, trust, respect, teamwork. This is why I say every manager should be the CFO for social capital in their unit. They should be building these currencies of social capital relentlessly, never wasting an opportunity to create more. What you don't see is compensation and adequacy of staffing. You could see them if we squeezed 4 times as much data onto this slide, because they are down there. They're just way down there. They are the weakest 2 risk factors at 1.4 and 1.6. They are risk factors for losing people, and of course, we should be trying our best on them. But most organizations cannot create sustainable competitive differentiation by paying more or hiring more staff. You have to hold on to your best people through social capital. Now, we can't take pride in social capital for granted just because we're good people doing good work. We have to seize opportunities to build it. Now, one example I love comes from the darkest days of the pandemic in New York in the late spring and summer of 2020, when places like Elmhurst and Montefiore were just being flooded with incredibly sick patients. You remember that time. We didn't understand the virus. We didn't know what helped, and we didn't know what didn't help. The EDUs and ICUs were flooded, and death rates were high. The staff were overwhelmed, and they were depressed. Now, the fact is, not everyone was dying, but it just felt that way. The actual ICU mortality at that time was 20%. But 20%'s a lot. Those deaths drain you. There are a lot of people here who have had the experience of having more than one patient die in a single day under them. It's sad when one person dies, but when you lose more than one in one day, that's devastating. The truth was that the hard work of our caregivers were getting a lot of patients through their illnesses, even back in those early days. So an ICU nurse at Montefiore suggested to her boss that the hospital play a song over the overhead every time a COVID patient was extubated or discharged. Someone else suggested Alicia Keys' New York. Now, if you don't know that song, play it in your room tonight. And imagine hearing it suddenly come through the overhead several times a day. If you've seen that classic old movie, It's a Wonderful Life, you'll remember that whenever people heard a bell ring, it meant an angel had gotten his or her wings someplace. Alicia Keys' song coming over the overhead had that kind of effect. Staff started tweeting about how they were hearing it for the 3rd time, the 4th time that day. Alicia Keys read the tweets, and of course, she loved them. and she gave an open-air concert, drive-in concert, for COVID essential caregivers on September 17th of 2020. It was a great concert, and of course, the highlight was when she sang New York. You can see it on YouTube. Now, experiences like having Alicia Keys sing New York to you helps with the second step of social capital, strengthening the sense of belonging. Now, you can do that by creating real teams, groups where people really know each other, and they share work, they share accountability, they pick each other up when one of them needs help. On a broader scale, beyond teams and across organizations, you create a sense of belonging by sharing stories that reinforce values that bring pride. The Alicia Keys concert was one such experience. The photos on the right show another. They're from something that happened outside Carillion's Roanoke Memorial Hospital 7 years ago. We got a bunch of folks from Carillion here too. And what happened was a dying patient told nurses that he would really love to see his horse one more time before the end. Now, there weren't any policies that could enable such a visit of a horse to a patient. But better put, there weren't any policies that the staff let get in the way. So they brought the patient, intubated, and the horse to the circle outside the hospital. And everyone at the hospital that day was either outside or watching from the windows and applauding. It's a story that everyone at Roanoke that day remembers. And it's a story that everyone at Carillion should know today. This is the kind of action you take to build a sense that this is a place that I want to be, a place where values trump policies and procedures. And then with those strengthened bonds between the nodes of your social network, you work relentlessly to spread the right values over those bonds. Now, one of those values we want to spread is respect. Remember how last year Pat Ryan said on the stage, respect should be like hand hygiene? Well, our data showed that it's probably something like hand hygiene was about 1988, which is the year that Purell was invented. You know, a nice idea, but far from the norm. This figure shows response by job type on a 1 to 5 scale to the item, this organization treats me with respect. Managers and leaders are at the top, well over 4. But way down at the bottom are nurses, security guards, technicians, maintenance workers, the people most in contact with the patients and the public, and very often the people least able to take respect for granted. When it comes to respect, we have a tale of two cities. And when people do not feel respected, we have found it is a 7.6-fold risk factor for them wanting to leave the organization. Now, this graph shows the relationship between how employees responded to that organizational respect item and overall patient experience outcomes. On the x-axis of the two graphs, your organizations are separated into 4 groups, quartiles based on how employees respected to that respect item. On the y-axis are percentile ratings for your organizations, for patients' ratings of their care and how they rate the hospital. We have so many graphs that show the same kind of association. Good things in the human experience correlate with other good things. If we can build the currencies of social capital, trust, respect, teamwork, high reliability, there are many, many ways in which the return on investment will be realized. That's why I think managers should see their biggest roles as building social capital, just as the CFO focused on financial capital. So how do we go about building social capital? Some of the work I've been describing is about strengthening the connection between people in our social networks. You may not be able to get Alicia Keys, you may not be able to have a horse visit, but there are ways to strengthen those sense of belonging and connection. But then we have to spread the right values across those networks, reinforcing them with social norms, like the employees of Mayo Clinic not looking at their phones when patients are around. How do we turn values into social norms? I hope you won't mind if I draw upon my cultural background as I wrap up. This painting is a portrait of Confucius, the Chinese philosopher from nearly 3,000 years ago. Now, like all philosophers, Confucius's teachings focus on that fundamental question, how to be good. Western philosophers tend to be more inclined to talk about clear rules. The classic example, Immanuel Kant's statement, one should never lie, even if it would save someone's life. Now, Confucius had a different take. He felt that life is complicated and that the right thing to do is often not clear. It's not easy to come up with rules that are the right thing for every setting, for scenarios we haven't even thought of yet. But Confucius believed in the power of rituals, frequent, predictable moments in which we behave as if we are the way we should be. An older person walks in the room, and we stand up as if we are respectful. A patient is lying in a bed, so we sit down as if we are respectful. Someone from housekeeping cleans a room, and we say thank you as if we are grateful. Confucius believed that if we behaved as if we were what we should be at these moments, it would hone our instincts so that we would be more likely to be the way we want to be the rest of the time. Now, when I've discussed Confucius's ideas about ritual with my high reliability colleagues, they immediately say, well, he was talking about what they call habits or universal skills and behaviors, basic underpinnings of high reliability organizing. I think that managers should be managing rituals for themselves and their teams, like treating people with respect, like treating humans like humans, in the same way that we approach the goal of zero harm. So let me close by coming back to what I said at the outset. Every manager should feel like they are the CFO for social capital. We can do this, but it takes more than good intentions. It takes the same kind of steps that your CFO uses in building financial capital. That means measuring what matters, prioritizing opportunities for improvement, creating plans, implementing them, monitoring progress. You will be glad to know that every CFO I've tested this concept with loves it. They want us to be as disciplined and as intense as they are as we build social capital. I hope that each of you will see your role in that way. You are building something hugely important, social capital for your organization, and I hope that you'll see my colleagues and me as supporters of this work through our platform and through our data and through our insights. When we build cultures in our parts of the organizations with great teamwork, with norms of trust and a sense of inclusion and belonging, our data overwhelmingly show that the returns will include better performance of every kind. Medicine is always going to be hard. That is what makes it so great. As I said earlier, the magnificent and the terrifying thing about medicine is that you are starting from scratch every time you walk into a room, virtual or otherwise, and interact with a patient. But if we are successful in building social capital around you, you won't feel like you are going into that room alone, and you won't go in unprepared. Thank you.